Hello, everyone. I'm really sorry. My laptop went off, so I had to wait it to load. But I think we are now quorum. We just have maybe 10 more to join. So today I'll be moderating the session with Eziani. Linda will be our main moderator, and this is the 20th session of our Building a Healthy Mother and Child training in our cohort 2, and today we'll be having our speaker, Dr. Joyce Tebet. She joined very early at 7 with Eunice, and she'll be doing the topic on introduction to maternal mental health care and reaching out for support. So maybe Eziani, you can say something, and then the speaker will now continue.
Hello. Are you getting me?
Yes.
Okay.
Yes, you can.
Sorry for being late. He was held up somewhere. We can start the session. Then if you have questions, you can just chat. You can just text them in the chat box. We'll review them at the end of the session. Thank you.
Welcome, Dr. Joyce.
Okay, thank you. Good evening, everyone. My name is Joyce Tebet, and I'm happy to be here to discuss this topic. Once again, we had a discussion sometime last year, and we will be talking about, we'll just be having an introduction to maternal mental health. So to start us off, just to have a background of what happens really when we talk about maternal mental health. So we'll have a brief of what happens so that we are able to understand. So we'll have the definitions and be able to follow through all the way to what are the possible effects and what we can be able to do to manage these conditions. So mental disorders, generally, if we look at it broadly, they affect everyone. And when we think about our families, it affects the children, it affects the families. The challenge that we have is that very little attention has been put on mental health, particularly maternal mental health, which sometimes they are not detected or they are undertreated. Because most of the time the assumption is that when a woman is pregnant, they're essentially normal, and this can be missed, which at the end of the day, it comes with very serious effects. In the low and middle income countries, this challenge is quite big as compared to maybe the other developed countries. However, it does not mean to say in the developed countries, this is missing. The challenge that we have again in our low and middle income countries is that there is very limited documentation. If you try to look at studies that have been done around mental health, there are very few, particularly those that are comprehensive in regard to maternal mental health. We also have another issue that affects how we approach maternal mental health, and this is the cultural and how we are socially accustomed to mental health problems, like the issues of stigma that come around. So this tends to affect how we approach and manage maternal mental health issues. This is a condition that affects very many women. About 1 in 4 women, they present with perinatal mood and anxiety disorders. And these perinatal and anxiety disorders, mood and anxiety disorders are very common, particularly during pregnancy and also after childbirth. And as a result, the women who suffer these conditions have serious consequences that we will see as we move along. So let's just understand a few definitions. Mental health is not the same as mental illness, as we can say. So when we say mental health, it does not necessarily mean that a person is having a mental stability, but it may mean that they have a mental illness, but it is about how are they able to handle. If you look at DSM-5 classification of mental illness, there are those disorders that are major and minor. So sometimes someone may be having something like stress, for example, but how are they able to cope with that? So if they are healthy mentally, then that means they have the capability to be able to manage that condition. So it means this person has a sense of purpose and a sense of connectedness to others. So if you look at this picture, there are issues that come around when we are talking about mental health. We have stress, anxiety, sadness, sometimes illness, sometimes someone requires help. So all these, in a way, contribute to how are we stable mentally. So what is mental illness? Mental illness is about that negative aspect of the condition where a person may be thinking about something, or they are feeling like maybe they're feeling sad, or eventually how they behave. Like say, for example, when they're thinking, they could be stressed. They have a feeling, they may be depressed, they're feeling lonely, they're feeling isolated, or they behave, now they become aggressive, they're throwing tantrums, they're breaking things here and there. So all this in a way would tell us that this mental status, the mental health of this person is affected. So mental health or a mental disorder is actually a diagnosable condition. And as we have mentioned, it may include things like crying, grief, loss. All this may contribute to having a mental illness, and this may be seen through a person's thinking. So their thinking is affected, their perceptions, their mood, or even their behavior. So now coming down to maternal mental health, we are referring to, when we say maternal, we are talking about the period during pregnancy, during labor and childbirth, and also after birth, the first 6 weeks after birth. That is when we are defining maternal. So when we say maternal mental health, we are referring to that time period. And WHO defines maternal mental health as a state of well-being, where a mother is able to realize their own abilities, they can be able to cope, they can be able to manage any stresses of life, and they can work productively and also fruitfully to contribute to her family and even to her community. So this tells you this woman is healthy. Other definitions, I know I've mentioned perinatal mental disorders. So these are disorders that occur during pregnancy, and also they go through all the way to the first year of the postpartum period. So here we are not limiting to the first 6 weeks, which is a period of puerperium, but it goes beyond, because sometimes we have this condition beginning and sometimes it takes long for it to clear. We have defined what mental illness is. And so now the question is, why are we concerned about maternal health? Why is because if you look at this pregnant woman from this flow chart, we have this pregnant woman who is carrying a baby, and this becomes a child and eventually an adult. So what happens? When this mother is affected during pregnancy, there is a possibility that this will be carried on to this child, and this child may develop adult psychiatric illness, which is as a result of what happened when the child was in utero. So it is important that we think about addressing maternal mental health issues so that the children that are born have a good outcome instead of them being predisposed, and therefore at the end of the day, they may be predisposed to mental illnesses. In low and middle income countries, as I mentioned, we are the most affected. If you look at this, this is from Maternal Health Task Force 2019. 1 in 4 women experience antepartum depression. Antepartum is the period before, during pregnancy. And then 1 in 5, after they have given birth, they are predisposed to depression. This is for depression alone, but there are many other mental health conditions that women can suffer. So this is just to give us a picture of what really happens to women when they are pregnant. So they are predisposed to depression. And then still, when we look at in a way, the effects of this mental illness. So we have said 1 in 5 women, they suffer from postpartum depression. The challenge is that only less than 15% of these women receive treatment. So most of the women who will come with this condition, sometimes, as I said, the condition may be missed or the condition is undertreated. So if we look at our settings, for example, sometimes it could be because the emphasis on maternal mental health is lacking. So the healthcare workers do not really focus a lot on screening for mental health issues. And there are screening tools available, quite a number. So less than 15% of women receive treatment. Up to 50% of women living in poverty are predisposed to a mental disorder. Again, poverty is a contributing factor. It's not only the mothers who will be affected, but it also affects the entire society. And globally, we have about 600,000 women who suffer from mental illnesses, particularly in the United States. Anxiety and depression, again, is a common, these are 2 common conditions among the teenagers. So if you look at, when we are talking about maternal health issues, we don't leave out the teenage girls because they contribute a lot. Some may become pregnant from the age of 15 to 19. They become pregnant. They are predisposed, highly predisposed to anxiety and depression. One, because of maybe what is happening around them, the socioeconomic status, the lack of support, and many other factors. So this explains the reason why we have about 37% of these girls being predisposed to anxiety and depression. And it's not only the women who are affected, but we also have the fathers. So 1 in 10 fathers tend to experience a perinatal mental health. At the time when the wife is pregnant, they're likely also to experience a mental disorder. It could be anxiety, they don't know what to do or what to expect, what will happen once the child is born. So that aspect tends to predispose the men also to developing mental illness. So the unfortunate bit, these statistics from UK, and it's very, very latest from 2021 by somebody called Cantwell. They established that 1 in 7 women died of suicide. And these were women who were followed up between 6 weeks and 1 year after pregnancy. So they died of suicide. There are still many other causes, but if you look at this, 23%, that is not a small number, about a quarter of women who died. A quarter of these women were actually maternal cases. So the contributing factors are many, but I've just picked a few, like marital relationship. If there is poor marital relationship, the young age, we've just talked about the adolescence, giving birth to a child who has complications, maybe a preterm baby, or as a non-preferred sex. Maybe they gave birth to a female, they wanted a male, or they gave birth to a male, they wanted a female. This predisposes them to stress, and as a result, they may be predisposed to mental illness. The environment, which if the environment is not conducive, like if there are conflicts, there are disasters, violence, migration, these tend to affect the stability of the mental health. Prevalence of HIV, like in our low and middle income countries, the prevalence of HIV is high, and this has been found to be a contributing factor where women are not empowered. So women tend to depend on on the men. That lack of empowerment is also a contributing factor. The socioeconomic status is also a key contributing factor, particularly the low socioeconomic status. The race and ethnicity, it has been found that the Blacks are actually highly predisposed to mental illness. Lack of social support, fear of stigma, lack of access to the services that the women have access to. They're not able to provide mental health services. So that contributes, and it means they're not able to diagnose that condition early. If the pregnancy was unintended or unplanned, a pregnancy loss, it's not always that someone wishes to have their baby out. So if they had an abortion, they'd been longing for a child, and then an abortion happens, then it becomes so challenging for this woman to manage that situation. As a result, they are predisposed. Obstetric complications, where we have complications like maybe they have prolonged labor, they labor for 24 hours, they have a very difficult labor, a very difficult birth, or any other eclampsia, very high blood pressures during pregnancy. So all these tend to contribute to or predispose the woman to mental illness. Alcohol and drug abuse, this is a big challenge that we are seeing of late. So it becomes a very big contributor. And also if a woman had a major negative event, like maybe they lost someone, they lost a beloved person, or something happened in their life that was a very major negative event, or maybe they even lost their child. So this becomes an aspect that contributes to mental illness. Unlike COVID, for COVID, we know we can mask and prevent. For mental illness, we do not have a mask to prevent mental illness, but there are steps that we can take to help us so that we avoid mental illness, or we are able to manage the mental illnesses. We have talked about the contributing factors. So there are certain red flags that would warn someone. For example, a sudden change in the mental state. Someone who has been jovial, suddenly they just go quiet. If maybe there are new thoughts, this person just thinks, I want to end my life, I think I'm useless. So those new thoughts, those are red flags. That is something to warn that something is not right. Or maybe there are new and persistent expressions of incompetency. For example, this mother, they feel I'm not capable of taking care of this child. I feel I'm so incompetent. I feel I would have done better. So those kind of feelings, when you see any of these, then you need to do a quick follow-up and be able to assist this mother. These are just a few of the many red flags that can warn you that this woman is not doing very well. So just to highlight, I know possibly there is a session to talk about the mental illnesses in detail, but I'm just picking out about 4 common maternal mental illnesses. So we have the baby blues, or what is commonly known as maternal blues. This is a very temporary state that affects women immediately after they have given birth. So it lasts about 2 weeks, and the woman may be feeling very happy, or sometimes they're very sad, or they're just crying for no apparent reason, or they're feeling impatient, they may be irritable, they're restless or anxious, or even lonely and sad. It is very, very common. It affects about 80% of all postpartum women. So it means almost all women who have given birth, they tend to go through this. Those of you who are medics, when you do the stages of preperium, the psychological stages, we have what we call the taking in, taking hold. So there are those phases that a woman goes through psychologically, and this explains why we have the maternal blues. Mainly, the main reason why we have this is the hormone fluctuation. During pregnancy, we have high hormonal levels, particularly estrogen and progesterone. But then after the woman has given birth, then we have low, these hormones go low, and we have the oxytocin and progesterone levels going up. So that aspect of balancing the hormones tend to contribute to the baby blues. So that is one very common maternal mental illness. Another one is depression. I'm not going into the details, but we know that depression is characterized by low mood, loss of interest, or even the person feels isolated. They feel like they do not want to be part of any person, any group. They just want to be alone. So that is a condition that affects women, and it is classified as one of the major illnesses. Anxiety disorders is also common, particularly if the woman is adjusting, or they're adapting now from a pregnancy to being a postnatal woman. And then we have tocophobia. Tocophobia is extreme fear of childbirth. So maybe this woman has some preconceived ideas, or they have information about, or they had a traumatic experience. So they have very, very persistent fear of childbirth. And that is what we call tocophobia. It's also a mental illness. Then we have post-traumatic stress disorder. This does not happen to pregnant women alone. It can happen to any other person, but for this particular case, it may be experienced by women, 9% of women who had postpartum post-traumatic stress disorder previously. So it's likely to repeat itself. Other reasons why this may happen is because they could have had a serious physical, emotional, or psychological harm, like we talked about, if there was a previous negative event. If the pregnancy was complicated, so they kept developing complications, this is treated, they develop another complications, or generally the birth was complicated, maybe they had a cesarean section, less to the expectations, or they even had a vacuum delivery. If there is lack of communication, there is lack of support, or the feelings of powerlessness, this could contribute to post-traumatic stress disorder. And finally, in the disorders, we talk about postnatal psychosis. So this is the most severe form of the mental disorders, where now the woman is psychotic. They may present with a bipolar disorder. It could be because of alcohol or substance abuse. As you may remember, we said alcohol and substance abuse is a contributing factor to mental disorder, and this contributes to psychotic symptoms. As a result, then the woman is classified as having postnatal psychosis. So when we look at these maternal mental illnesses, the maternal mental illnesses have a great impact. As we saw earlier, they have a great impact, not only on the woman alone, but on the fetus, on the child once they are born, this child during the adolescent period, and later during their adulthood. So in infancy, of course, before the baby is even born, this woman, if say, for example, they are depressed, this woman is not able to feed well. As a result, this contributes to low birth weight. So the baby does not grow very well in utero. And this increases the risk of having a low birth weight baby. There is a low rate of exclusive breastfeeding because this woman may not be able to breastfeed effectively considering her mental health situation. And this causes now other risks to the baby. It increases the risk of mortality, of course, or even morbidity, ill health. For the child, as a result of not breastfeeding or lack of good care, then the child is at risk of being underweight or having a stunted growth. They are at increased risk of poor cognitive development. So their mental development is affected. They are also at increased risks of episodes of diarrhea and childhood illnesses, as we have mentioned, and immunization, because if the mother is not mentally okay, that means she may not even be able to understand or remember when to take this baby for immunization and so on. So these children tend to be immunization dropouts. During the adolescent period, so this child has grown, so during adolescent period, there is a high rate of suicide as a result of that effect that they had, the cognitive development, or the fact that maybe the mother is not able to support. So as a result of all these stressors, then it increases the risk of their own illness during puberty. And as a result, now the cycle of poor mental health would continue. If this adolescent would get pregnant again, then there will be disruptions of maternal-infant bonding, leading to inadequate care during pregnancy and even during the postnatal period. Then they have preterm babies, then they have a difficult period during the postpartum, they have difficult infancy, then childhood also becomes difficult and the cycle continues. So our intention is to break this cycle so that if there is a mother who has a mental illness, then they're not continuing with that mental illness, and even their children are not continuing with that mental illness. As we have seen, maternal mental health has a ripple effect from the person to their family, to the community, and eventually to the world. So mental illness, maternal mental illness has a lot of negative effects. Like if we look at this diagram, this woman is pregnant. She has depression. So she has high cortisol levels, which predispose her to having stress. As a result now, the baby is not able to be well taken care of nutritionally, for example, if she's not feeding well. So this affects the growth and development of the child. And like we have mentioned earlier, the infancy of this child is also affected. So during the neonatal period, this one may be predisposed to obstetric complications, there's brain alterations, behavior deficits. So the baby, as a result, is likely to pick these aspects. And then they have behavioral dysfunctions during their childhood, emotional dysregulation, brain alterations, metabolic dysfunctions, and so on and so forth. So you've seen how this impact from the mother to the child, and eventually even in their adulthood ages. Just to break it further, we have talked about this preterm birth, low birth weight, insecure attachments, and even poor breastfeeding practices. So the children tend to have social problems, they perform well in school, and they develop mental illnesses themselves, as we have said. And this can have a negative effect on the family and even on the society. We talk about COVID just to understand what really happened during the COVID period in regard to maternal mental illness. So there was a lot of loneliness and isolation, particularly because of the social distancing, which contributed to stress and anxiety. Women tend, let's say, for example, this was a pregnant woman or a postnatal woman was breastfeeding. They were not sure what to do. Remember that time there was limited movement, the limitation of movement. So if this woman wanted to maybe seek care in the hospital, they feared the curfews and so on. So there was the aspect that they were afraid. That now led to trouble in concentrating, changes in appetite, trouble in sleeping. And this, if they had a chronic illness, like maybe they were diabetic or hypertensive, there is a possibility that these illnesses worsen the effects of COVID-19. So what do we need to do? We need to detect early these conditions. We need to talk to women first, talk to enlighten our communities so that when the communities understand about mental illness, they can be able to refer clients as early as possible. Healthcare workers should be able to have the screening tools that would help in early detection and also appropriate treatment. Psychoeducational interventions. So psychologically, people need to be empowered. What should they do and have the knowledge regarding what information or what support is available regarding the mental illness they may be having. Improving mother-child relations, as we have seen, there is a very close relationship between a poor relationship and mental illness. So if we intend to cut off the cycle, as we talked about, we need to improve maternal mother-child relationships. We also need to improve partner relationships. As we saw, one of the contributing factors is lack of support. Another thing is we need culturally sensitive, solution-focused psychological therapies. Many of our cultures are not very sensitive to mental illness. When someone develops mental illness, people tend to stigmatize them and they are isolated. So if we have a culturally sensitive, say for example, a community innovation of how to approach mental illness, something that the community has come up with, something that is culturally sensitive. So that means you need to understand the culture of that particular group and be able to help so that they have that solution that is culturally acceptable. Improving social support for women. Like we said, one of the challenges that contributes is lack of women empowerment. So if we have a situation where women have the support or the women are empowered, then this can help in improving maternal mental health. Improving access to education and say, for example, vocational training for girls and women. We have maybe girls who have dropped out of school because of early pregnancy, then they can go into vocational training so that they have something to do for themselves to be empowered. Then there are many, I liked this poster. I got it from Perinatal Connect website. They have several approaches that they look so easy and approachable when we think about solutions to maternal mental illness. Addressing the barriers, that's number one thing. What do we need to do? We can address the barriers, have a person-centered approach because each individual is different. Have rural access programs. We know our settings, the larger population are in the rural areas. So when we are able to address, have an individual approach, and we're able to create access in the rural areas, then we're able to reach more women. We also talk about collaborative approach to care. When we talk about mental illness, it's not only the doctors or the nurses who can be able to take care of this woman who has a mental illness. We have other team players. We need the psychologists, we need occupational therapists, we need the pharmacists. So we need everyone on board so that they can be able to help, including even the nutritionists. So having a collaborative approach is a very good approach that will help ensure that the woman is taken care of holistically. And at the end of the day, we are able to overcome stigma. We're able to focus on prevention and even address issues like lack of finances. For example, ensure that our insurance is able to cover. We know the women have the Linda Mama, but the Linda Mama cover, which I'm told it's able to cover the women for up to 1 year. So what happens after that? So if we have this address, then we can be able to increase and be able to meet the needs of the women, which include, for example, issues of transportation, food insecurity, childcare, and we can even have an innovative approach that would help, in addressing, like telehealth is one thing that, if you look at the maternal reproductive health guidelines, which were developed during COVID, telehealth was one of the suggestions that was put in place. So if we are able to begin by looking at understanding the needs of each community, address the needs, and be able to follow through in bringing everyone on board, then at the end of the day, we can be able to manage the women who are affected. And not only the women, the men too, and also their families. So when we talk about reaching out, we say there is no shame when we are talking about maternal depression or maternal mental illnesses. And when someone comes to ask for help, then asking for help is a sign of strength. We need to hold that person and lead them to the right path so that they can get the help that they require. Engaging in mindful moments would help improve maternal mental health. Limiting consuming too much news. Like now, I know we are in the electioneering period, and there's so much information about who should be voted in, who should be voted out, and so on. And sometimes this tends to destabilize mental illness. We have had, or we have even witnessed people who kill themselves. Let me give an example. I don't know if there are men here. If maybe there was a football match and one team won, and maybe that was not your team. You see, we have had people who smash their TVs. You still need that TV tomorrow. So limiting those too much information can also help in improving the mental illness. Spending time and connecting with individuals who you can be able to relate with and talk about things that are bothering you. In psychology, they say men suffer most because they don't talk out. Women, because they talk, they are likely to have a better mental health compared to the men. So having time to connect with people and talk about things people who can be able to give you the positive approach or positive support and help. Also making time to distress. Sometimes you feel you're so stressed, you want to blow up, and you decide, maybe let me just walk out, and that walking out can help. Or you want to sleep, do something that can help distress. Being up to date on routine preventive health, for example, if there was a need for vaccinations, like now we're talking about vaccinations for COVID or any screening, then this may be recommended or as recommended by the obstetrician gynecologist or even the midwife practitioners. They can be able to recommend what is appropriate for this woman in order to manage their mental health. So what we are saying is it doesn't have to end here. And here is Mathare Hospital. We know Mathare Hospital is the largest mental health hospital in our country. We can be able to prevent maternal illnesses before they reach the point that this woman is hospitalized. If we pick them early, we address those issues as early as possible, then we avoid the hospitalizations, because hospitalization comes with its own challenges. We need to encourage better mental health through team building, working together. From this picture, you can see this person looks so stressed because they are all by themselves. The others seem to be working and consulting each other. So having a team approach can be very, very helpful. Something else that is also affecting our young people today is the social media. So I thought I could mention, I know this is a group of young people. Mental illness, if you look at this social media icons, I know they're much more familiar to you than me. Something that has a net positive impact put together is YouTube. But then we have these that have a net negative, maybe because they're not filtered, the information comes as raw, or maybe what people post tends to stress others, Instagram, Snapchat. This contributes a lot to the negative aspects of mental health. Which again, why I brought this is, if you remember from our chat, I know we are talking about maternal mental illness, but then if these issues affect this individual, then it predisposes them maybe later on in life to have a mental illness. Addressing inequalities in maternal mental health care, as we said, this is an area that there is very little attention that has been paid. So it is important that we address these inequalities, having holistic support, building alliances, providing support, for example, in family planning, physical health, and also adopting trauma-informed approaches that can help in managing maternal mental illness. And one thing we need to remember is that it's not only the women who suffer, but the fathers suffer too. This is a case study, and this was a father who had challenges. It was a first-time dad at 23. So what he said is that it was after speaking to the counselor that he understood why he was drinking so much. And that had put him in a depression. He was depressed because he was feeling like he had a child who was not planned, and he was supposed to be working more, and he didn't want to be around the baby. So he had a lot of issues which drove him to drinking a lot. So let's not assume that the men are not also affected. The men too are affected. And when we are talking about maternal mental health, we need to think of a family-centered approach so that we have this woman who may be having a challenge, we bring their man too so that they can be supported together. So let's make maternal mental health a priority. That's the end of my discussion. I have a few references. Thank you very much. So that when we have addressed our mothers, then we have such a broad smile. Thank you very, very much. Back to you, Eziani.
Thank you so much, Doctor. I welcome any question. If you have a question, you can ask. You can type in the chat box, then I read them.
It seems there are no questions.
Hello.
I'm saying it seems there are no questions.
If there are no more questions, I think we can just end the session. Thank you so much. There is a hand, Teresa. Teresa, you can ask your question.
Okay. I'm still trying to formulate the question, but do you have any thoughts on a pregnant mother who has a history of like mental illness with regard to now the mother being pregnant? Like she's pregnant, but she has a history of mental illness.
Thank you very much, Teresa, for that question. Yes, when a woman has had a history of previous mental illness, then they are likely to be predisposed. So that is already a risk factor. And when you're managing such a mother, you need to be aware that this mother is likely to be predisposed to that mental illness, and therefore interventions have to be put in place early so that she doesn't go back to the same condition. I hope that answers you.
Yes, thank you.
Okay.
I can see there is another question in the chat box. It says, what brings about postpartum depression?
Thank you, Jeria, for that question. Maternal postpartum depression, it may come as a result of antepartum depression, or sometimes because of what we mentioned as the contributing factors, maybe lack of support. The woman has had a very difficult labor and birth process. So those contributing factors may be predisposing to that, including even the genetic factors. If this woman had came from a family lineage that they suffered, so they could be predisposed because of that. The actual cause is unknown, but there are those contributing factors that are linked to the mental illnesses during the pregnancy and also during the postnatal period.
Okay, I hope they are answered. There is another question also from Carol. Can some mental illness discourage a mother from getting pregnant?
I'm not sure I have a direct answer to that, because getting pregnant is usually an individual decision. So I don't know exactly what you mean. Is it that maybe this woman, because of their mental condition, they feel like they don't want to be pregnant? Or is it that the mental illness is preventing them from getting pregnant? But I wouldn't say that because it is pregnancy is really about the individual person when and if they want to get pregnant. But then any mental illness preventing pregnancy, I'm not aware of.
Dr. JJ, maybe.
Yes, Eunice.
In addition, I think that's a very relevant question about postpartum depression and the fear of which, and also, of course, tocophobia. So, of course, when someone has tocophobia, there's a high likelihood they wouldn't want to go through the pain of labor and birth. So, obviously, they may tend to avoid pregnancy by all means. Okay, and then also postpartum depression, the effect, especially socially, is not very good. Culturally, it's not a very good thing that you'd want to see. So in fact, it's not even the woman themselves who would not want the pregnancy. Most of the time, it's their spouses who would want to discourage them from getting pregnant because of the effect that maybe they saw the woman having, especially postpartum depression. So I think, yeah, it can discourage a woman and also family from getting consecutive pregnancy. Thank you.
Thank you, Eunice.
I think there are no more questions in the chat box. I have this question. Can a mother who's having, like, for the first time she's having twins, can that lead to having a mental health issue?
Yes and no. Yes, because maybe if they were not expecting, they may be predisposed to stress. And no, if this is something that they had planned for and they have good support, then they may not be predisposed to mental illness.
Okay, thank you.
You're welcome.
I can see there is another one. Does mental issues or stress affect the baby?
Yes, from what we discussed, the woman who is pregnant, if she has a mental illness, then that is likely to affect how the baby develops in utero, and also how that child will grow as after they have born. So yes, mental health issues can affect the baby. Like we said, this woman may not be able to feed well, they may not be able to breastfeed. So this affects the cognitive function of the child.
I think they are answered. It was from Jeriah. Hope he's been answered. He says thank you.
Okay.
There's another one. Are there ways we can help these women with postpartum depression when we can't afford professional help?
Eunice, please take that.
Kindly come again. Come up again, kindly.
Okay. Are there ways we can help these women with postpartum depression when we can't afford professional help?
Yes and no. The main thing is, as Dr. JJ mentioned, during postpartum period, there are some stages a woman goes through, especially. So the support within the family has a long way, especially social support and general community support of this particular person can actually avert mental health. But in real sense, I think it's prudent to seek professional help, and there are many facilities that are actually free of charge at the moment. Although if there is enough social support, then there's a high likelihood these women's symptoms may be managed appropriately. I hope I've answered. Thank you.
Anne, hope you've been answered. I think she's been answered. I think there are no more questions. Thank you, Dr. Jibet and Eunice, for the session. I've learned a lot. It's our responsibility as a whole. It's not just like for the mother. It doesn't only affect her, but since it starts from her, it it may even affect the whole society. Thank you for the session. I hope we've learned, all of us. Thank you.
Thank you.
Thanks for the nice presentation, Doctor. I think we can end the session from there since there are no more questions.
Thank you once again. Enjoy your evening.
Welcome.
Good evening, everyone. Good evening.